you have ever experienced a migraine headache, you will understand how debilitating and disabling this condition can be. The slightest movement or exposure to light or sound can make it feel like somebody is stabbing you behind your eye with a screwdriver. Your head is pounding, you are overtaken with nausea. When you have a migraine, all you want to do is find a dark, cool, quiet place to curl up in a little ball and wait until you vomit and the migraine subsides spontaneously, or until the pain medication you've taken knocks you unconscious. Now, we don't really understand what causes migraines, but we think that it might be related to changes in blood supply in the blood vessels around the brain. So anything that can change the caliber or the pressure in the blood vessels around the brain can potentially trigger a migraine headache. Now, there are lifestyle factors that are foods or behaviors or exposures that can trigger migraines for people. We know that caffeine, chocolate, alcohol, and cheese are very common food triggers. Unfortunately, they're quite delicious and sociable things. But also exposure to different changes in temperature. So if you go from a cool environment to a hot environment, intense exercise where you are changing your body temperature rapidly, your heart rate, your blood pressure changes. If you are exposed to screens or bright lights and glare, so people who do a lot of driving or a lot of computer work tend to be at a higher risk, as well as dehydration, lack of sleep, and stress. It's really helpful for you, if you suffer from migraines quite regularly, to keep what we call a migraine or headache diary. Write down when you experience a migraine, what the severity of the migraine was, how long it continued for, any associated symptoms you had, and think about what you were doing and what was happening in your day before the migraine started. Oftentimes, you can pick up on certain behaviors or certain triggers that are recurrent and that you might be able to eliminate if you identify them. So try keeping a migraine diary and see if you can find your particular triggers and then minimize, avoid, or eliminate them to reduce the frequency of your migraines. Let me introduce you to Tamara. She was one of my patients who was suffering from migraines continuously. In fact, it was her boss who asked her to come and see me because at work she was constantly in a daze. She was working as a compliance officer in a financial firm, and so there was quite a lot of pressure on her to deliver. But because of the headaches and because of taking constant pain medication, her productivity was suffering. He could see that her concentration levels were low, and really she was not performing. So when she came to see me, I could tell that the migraines were causing her severe distress. In fact, in my consultation, she sat with squinted eyes. She was talking very softly because you could see that light or sound would actually hurt her. She'd been taking high doses of painkillers, anti-inflammatories, muscle relaxants, sedatives for months in order to try and control these headaches, but they simply were not going away. So once we ruled out any sinister cause by sending her for an MRI scan and doing some blood tests, We then had to look at her lifestyle factors, the things that could be contributing to the recurrence of these frequent headaches. Now, Tamara had a very stressful job, long hours in front of the computer, a lot of deadlines, but her home life also was not ideal. She was living with her parents and they were putting constant pressure on her to find a partner, settle down, have kids, so she felt like she was under pressure from all sides. She had very little time to exercise and almost no time for relaxation and to take care of herself. So her nutrition was a major contributing factor. In the morning, she didn't have time to eat breakfast, so she would have 2 cups of coffee with sugar and milk. She would have an effervescent energy tonic that contained a nuclear dose of caffeine, and then on the way to work, she would drink an energy drink, either Red Bull or Monster, in order to give her the energy boost that she felt that she needed. When she arrived at work, she would have another cup of coffee. For lunch, she didn't really have time to go out and eat, so she would order a panini or get noodles or fried rice delivered to her desk. In the afternoon, she'd have sweetened pastries plus more coffee. And in the evening, when she got home, she would have dinner with her family. Typically that would be rice, a protein and vegetables, but after dinner she felt she needed something sweet, either a chocolate or a sweetened yogurt. And on the weekends, when she had a little bit more time to herself and she felt she needed to unwind, she would drink vodka before going to bed. During the day, she did not drink any water at all. Sleep was horrendous. If she did fall asleep, she would be very restless. Typically, she'd wake up at 1 o'clock, 2 o'clock, 3 o'clock in the morning, and then her mind would be racing, thinking about what she needed to do for the following day. So, multiple factors probably adding to her risk of these awful headaches. We discussed possible ways that she could change her lifestyle in order to improve her migraines. The first thing I asked her to do was to cut down on the caffeine. The energy drinks, the coffee, and her vitamin tonic were not helping her headaches. In fact, caffeine is a major trigger for migraine headaches. Secondly, I asked her to hydrate with water. It's really important to make sure that you are well hydrated during the day so that the blood supply to your brain is nice and even and controlled. Then we looked at her diet and I asked her to start her day with a protein-based breakfast. Boiled eggs or a protein shake or an omelette, something that would keep her energy levels and her blood sugar nice and stable. And for lunch, I asked her rather to take leftovers from the night before so that she had something nutritious as well as sustaining to eat at lunchtime. Because ordering food that is processed and high in carbohydrates would not sustain her blood sugar at an even level. I also asked her to avoid highly sweetened pastries and chocolates and the sweetened yogurt because those things can also trigger a sugar spike which might contribute to migraines. I also asked her to have her eyes checked. With her line of work sitting in front of a computer for long hours, we thought that perhaps the glare from the computer screen and the eye strain might be contributing to the frequency of her headaches. So I asked her to get a glare filter for her computer screen And I also asked her, because she needed prescription glasses, to get a blue light blocking filter on her glasses as well, so that she would not be exposed to the intensity and the type of light that can sometimes trigger migraines. We definitely needed to work on her sleep, and so I discussed sleep hygiene with her, and I asked her before going to bed each night that she do some deep breathing exercises to help with relaxation and to activate the parasympathetic nerve system that would encourage better sleep. I prescribed a magnesium supplement for her to take at night because magnesium has been shown to decrease the frequency and the severity of migraines. And definitely it has got the power to improve those symptoms, but also improve sleep quality at the same time. The good news was that Tamara was able to reduce her dependence on medications. After about 3 weeks of making adjustments to her lifestyle, she did not need to take any painkillers for her migraines. And I saw her about a year later for an insurance medical, a routine examination. And she said to me that the migraines had completely disappeared once she'd eliminated the caffeine, gone on to a lower carbohydrate, even sugar kind of diet. Once she'd improved her sleep quality, the magnesium made a big difference, and she was hydrating well. So this case illustrates that lifestyle factors where you eliminate the potential triggers for migraine can make a huge difference and can have tremendous power in reducing your need to take medications and improving your quality of life. So my top 3 tips for reducing the frequency and severity of migraine headaches are: number 1, look at your nutrition and see if there are particular triggers that you can eliminate. Be sure that you eliminate high sugar, ultra-processed foods and try and get rid of caffeine. These are the most common triggers for migraine headaches. Make sure that you are getting plenty of good protein and eat high magnesium foods like leafy greens including spinach and kale, nuts and seeds, especially almonds and avocados. Number 2, have a consistent good sleep schedule. Practice good sleep hygiene, where you go to bed at the same time every day and you wake up in the morning plus or minus the same time. Include some relaxation techniques so that you can feel relaxed and happy and comfortable before you go to bed, and so that you promote good sleep quality. Sleep deprivation is a major trigger for migraine. And my 3rd tip is to maintain good hydration throughout the day. Drink plenty of water so that when you go to the bathroom, your urine is a nice, clear, pale yellow color with no odor. Try and drink caffeine-free beverages if you can. So enjoy water, sparkling, still, doesn't matter, infusions, herbal teas, all are absolutely fine. So these 3 tips oftentimes can help to reduce the frequency and the severity of migraine headaches.